If there is a finding in resisted neutral testing for shoulder flexion, manual muscle testing of the shoulder flexors would be indicated. The following muscles are involved in shoulder flexion. The following scale is used to grade manual muscle tests. Grades 3 through 5 are performed against gravity, while grades 0 through 2 are performed in a gravity-eliminated position. The anterior deltoid is tested with the patient seated, with the arm at the side and the palm facing medially. The therapist stabilizes the scapula and the clavicle, and the patient flexes the arm to 90 degrees. The anterior deltoid can be palpated on the anterior aspect of the shoulder joint, just distal to the clavicle. The resistance is given just proximal to the elbow in the direction of extension. Gravity-eliminated testing is performed in side lying. The therapist supports the arm against gravity. The coracobrachialis is tested in supine with the elbow flexed. The patient flexes and adducts the shoulder without internally rotating. The muscle can be palpated on the anteromedial aspect of the proximal arm. Resistance is applied in the direction of abduction and extension. Gravity-eliminated testing is performed in side lying, with the therapist stabilizing the patient's arm against gravity. The pectoralis major is tested with the patient in supine, with the elbow flexed to 90 degrees and the shoulder adducted to 90 degrees. The patient horizontally adducts the arm. The clavicular head is palpated inferior to the anterior border of the clavicle. Resistance is applied proximal to the elbow joint in the direction of shoulder abduction. Gravity-eliminated testing is performed with the patient seated and the therapist supporting the arm against gravity through horizontal adduction. A minor shoulder flexor is the biceps brachii. The biceps can be tested in the supine position. The patient flexes the elbow through full range of motion. The therapist gives resistance in the direction of extension. Gravity-eliminated testing is performed in the seated position with the patient's arm resting on a table.